405 Artery Jam by Darwin Hernandez, Cassandra Soriano, Angela Soriano, and Edwin George.
Atherosclerosis is an arterial disease caused by the buildup of cholesterol plaque inside the arterial walls, which causes a disruption in blood flow inside the patient's body. Many are not aware of having this problem due to lack of correlating symptoms. They are not at a higher risk of experiencing a stroke or a heart attack, America's #1 silent killer. There are more than 3 million cases documented per year, making this also a chronic disease because it can last for many years or even be lifelong. Current treatment is very invasive, or the drugs they use just take a long time to eliminate the plaque. They are not cost effective and very time consuming. Oftentimes, this disease gets worse before it even gets better.
So how exactly is our product going to work? We're going to be using porous iron oxide nanoparticles, which are going to be at the core with the biocompatible polymer shell. We chose Polymaxo 188 as our surfactant because of its anti-inflammatory and anti-thrombotic properties. It's also going to help prevent the aggregation of the nanoparticle. We're then going to load the pores with putrescine, the drug we're going to use. We chose this because it's going to activate the RAC1 protein and react with the macrophages in our bodies. This is going to cause the macrophages to eat more dead cells, which is going to help reduce the amount of plaque buildup. Once it's heated up, the polymers are going to cross-link, which is essentially going to help ensure that the drug is safe inside and does not release at any point we don't want it to. We're going to use an external magnetic field to move the nanoparticle to the desired location, which is essentially going to be where all the plaque is built up. We're going to use another magnet to create an inhomogeneous magnetic field. This is going to help create ultrasound waves, which are going to destroy the crosslinks of the polymers and release the drug. It's also going to destroy plaque itself. Because it is an iron oxide nanoparticle, once it decomposes, it will go into the cytoplasm, which helps dissolve waste products and help it exit our body naturally. You can think of our product as a fire truck. The fire truck itself is the nanoparticle. The driver is the magnetic field because it's taken into its desired location. The hose would be the pores inside the nanoparticles, and the water, which is essentially the solution, is not only the drug, but it's also the ultrasound waves, because both are helping get rid of the plaque.
Now, when we are comparing these 4 procedures to our own, there tends to be a lot of disadvantages that come along with it. Starting off, the coronary stent has the possibility of arteries collapsing or closing again, especially when this occurs, it is no longer a viable option. The balloon angioplasty tends to have the possibility of arrhythmia occurring and damage to blood vessels and bleeding as a consequence. Statin is used as a form of medication that is used to attempt to treat arteriosclerosis. However, it has the side effects of nausea, vomiting, joint pain, and extreme consequences of memory loss, liver damage, and kidney damage. The most invasive procedure of them all would be the heart bypass surgery, which has the possibilities of a stroke, heart attack, death, lung infection, and even injuries to the nerves. Compared, all 4 of these tend to have various prices to them, with ranging from as little to $36 for monthly pills to around $6,000 for angioplasties and coronary stents, and the most expensive of all, which would be the $40,000 for a surgery, which many patients cannot afford because these treatments are too expensive to buy.
We plan to start this process in 2021 to be able to finish by 2032. By 2023, we plan to start phase 1 and be able to finish our final phase in 2031 to be able to market our product. We plan to also mass produce the synthesis of the nanoparticles in 2032.
And now we look into funding. Funding will come mainly from companies and other medical organizations that might want to invest in us. We're going to need a total investment of around $8 million due to salaries, stuff such as market study costs, clinical trials, and other annual costs, which will exponentially increase over the course of 3 years, which is the estimated amount of time which we believe our project will come to.
Ultimately, we want to create a procedure that is able to incorporate the use of iron oxide nanoparticles, surfactant polymer 188, and magnetic fields that are going to be able to emit ultrasonic waves that is going to destroy the buildup of plaque within the clogged arteries. In addition to that, we also know that iron is a good MRI contrasting agent, meaning we will be able to track down the extent of damage that has been caused by arteriosclerosis. The procedure is way less invasive than if you take the surgical approach, and funding will be needed in order to jumpstart our clinical trials and ensure that we are catering to all of the hospitals and patients that are going to be using our procedure. Thank you.